Here we are, as you can see, at Western New York PET CT. Hi everyone, and welcome to Health Matters. Yes, this is a crossover show. Ava San Marco from Health Focus is my co-host, but unfortunately she's a little under the weather today and couldn't be with us, because you know we joined together to bring you Focus on Health Matters. This way then you get more viewing times and our sponsors get to come to you a few more times too. As you heard me say, we are at Western New York PET CT, which is part of Western New York Imaging Associates, and you've heard me talk about him all the time, Dr. Frank Mascaro. He's one of our corporate sponsors. He has several facilities throughout Western New York where he brings you the cutting-edge diagnostic imaging equipment to have you have the best imaging when you find yourself in the time of need. So I'm going to introduce you to him in just a couple minutes. So before I do that, let me thank our other corporate sponsors, Dr. Bennett from Bennett Health and Wellness, where you know we've been taping shows there, and he has been bringing you amazing information. He's a regular MD who takes insurance and is a holistic practitioner. You know that he's joined forces with Dr. Rapp and now Dr. Barnes, and is just bringing you awesome Eastern and Western medicine for your healing pleasure. How about that? And also we want to thank Kim from Mr. Frank's Day Spa, where she uses the color from Italy, and she had the gentleman in from Milan showing her the latest techniques in styling and cuts and coloring, and she's doing a wonderful array of services there too. Don't forget about the medical pedicures. And we want to thank Marge Reed from the Healing Spa, where she's doing non-surgical facelifts. Yes, you heard it, non-surgical facelifts, where she's helping us ladies stay beautiful, you know, getting rid of those lines and spots and all kinds of stuff she's doing there. So you want to give her a call too. So with no further delay, I want to introduce you once again as we give thanks to Dr. Frank Mascaro from Western New York Imaging Associates. Hi, Dr. Mascaro. Thank you so much for this continued support to not only this show, but to the community.
Anne-Marie, it's a pleasure to have you back here at Western New York PET CT. We always enjoy doing our spots with you and giving out information to the people that really need the information so they can make an educated decision on their health care.
And that's what's really important, folks. So make sure you take out those pens and papers, because Dr. Mascaro is going to help you to understand the process when you come into his different facilities, when and why you might need these services. And why don't you tell us a little bit about each of the different facilities that you have throughout Western New York?
Sure. We'll start with Western New York PET CT, which is on 700 Michigan Avenue, downtown Buffalo, right next to the 33 ramp. Very easy to get to from all areas of Western New York. We're right next door to Western New York MRI. Again, the same kind of location with great facility and great easy access from all throughways. If we go up to the north towns, we have Kenton Open MRI on Elmwood Avenue, as well as the Western New York Breast Health Center on Sheridan Drive, Lockport MRI out in Lockport, New York, serving our northern brothers up there. You know, that pretty much covers our whole area this way. We've got a couple new additional spots coming online pretty soon, so please stay around and keep in tune with Health Focus and Health Matters, and we'll keep you updated on all our new locations and making it easier for Western New Yorkers to get all their imaging.
And we do. It's a hard time keeping up with you, too, because your imaging equipment is in several other places, too. I know because we've done shows there. And I have to say, when I drove into your facility here, it's kind of fun because you drive in, you see Western New York MRI, you come around, you see Pinnacle, which we did a show there, too, and then you keep coming around, and then you find PET CT.
Correct.
Yeah, so tell people when they're listening, they're going, okay, so what does all that mean? Tell us like the distinction, and I know too about the Kenton MRI, because that's MRIs. If you've had them, you probably know they're in these tubes, and some people like me get a little uncomfortable if you have to go head first, and you have an open one in Kenmore.
Correct. We kept an open MRI because there was a segment of our population that had problems with claustrophobia. So it's a great equipment, great imaging, and it gives a person an opportunity to have the imaging done with other issues like claustrophobia. So it works out really, really well.
And what other, so when someone's going to go there, what kind of services would they be looking for? Their doctor might tell them what do they need? Because you can ask your doctor. You can ask your doctor to where you want to go. Because when I've gone for different things throughout my lifetime, and they'll say, oh, go here for this or go there for that, I say, well, this is where I'd like to go. So you have the power when you have the information.
Right. Well, at Kenton Open MRI, not only do we do open MRI imaging, but we also do CT. We do plain film. We have fluoroscopy, ultrasound. So we do a varied amount of services right at Kenton Open MRI. Here at PETCT, not only do we do PET-CT, but we do standalone CT. At Western New York MRI, we have MRI, as well as plain film radiography, nuclear medicine, and ultrasound. At our Western New York Breast Health Center, where we had a few shows,
yes,
we do women's imaging as well as ultrasound and x-rays. So we can cover any imaging at any of our facilities.
Oh, that's amazing. And I often tell the story, here I go again, but it's the truth. I live out in the South Towns, and when I went to my doctor, we found a little something he was concerned about. He said, Anna Marie, and this is before I even knew you. We're telling our age. He said, I want you to go into Western New York MRI. It's on Genesee Street in downtown Buffalo. I said, why do I have to go to downtown Buffalo? He said, this is the disclaimer, he said, and I agree, and I'm sure Dr. Frank agrees, that you have the best imaging here. So what does that mean? Like, you keep up on newer machines, better technology?
Absolutely. It's not just the machines themselves. Our technologists, who are integral part of our services here, are well trained. We keep them on cutting edge on all their CME credits and new repetition of on how the exam is going to be performed. So it's not only about learning how to do the machine, it's how to push the machine to get the best from the machine. And that's what our techs do, absolutely.
Wow, very interesting. So stay tuned, because we're going to take you behind the scenes to show you the machines and teach you some more. Look at those phones are ringing already. And teach you some more so that you have information. That information is power when you act on it. So Dr. Mascaro, tell us what people can expect when they come here.
Well, first of all, we have a friendly staff that greets everybody and is willing to help fill out paperwork or get the right information about the test and answer any questions. If they need a more in-depth discussion about the test, our technologists are always willing and helpful to our patients. But it's a comprehensive experience here at Western New York PET CT. It starts in our waiting room, which is very spacious and comfortable and relaxing. We have fresh cut flowers every day. We feel that we try to make it a little bit more uplifting, because the patients usually aren't feeling well. That's why they're here, to have some imaging done or at their doctors. So we try to take their comfort into account when we design our buildings and, around the imaging. Correct.
I have to say that's so important, because when you're not feeling well and you're coming in and you're confused, you have all that paperwork before anyone even sees the doctors or has the imaging. It's the staff that sits at that front desk that sets the tone and the atmosphere. You have the 2 TVs in there so you could see from either way. That is so important.
Absolutely. We don't want where certain patients have the best viewing of the TV, so we said, you know what, let's put 2 TVs in. So, you're not worried about anything. You're trying to relax before an examination. And after you come into our facility, you have a spacious changing room. They're all, with disabled accredited, and you get to lock up all your valuables securely. And then we have some special rooms that, when, if you're having a PET CT and you're going to have an injection, you get to relax and, pass the time before you're ready to be imaged. And we also have, enough room for you to bring a loved one with you just to keep you company during the injection time. So.
And that room is so beautiful. As soon as I looked inside there, I could see I don't know, I can't even explain it. It just felt like a overcoming sense of peace and comfort.
When we started to design the building, I wanted a spa-like feeling so patients could relax. We have Bose Wave radios in there. If you'd like to bring your own music, your CDs, you can play that and just kind of relax during the 60 to 90 minutes time during the injection period for PET CT. But we try to make it as smooth and comfortable as possible. And then, after that time period is over, you have your imaging done, and we try to make that as comfortable as possible too. Same type of decor inside the imaging suite. And our technologists are second to none. They're very well trained, experienced, and very nice. They really are.
Yeah, and when you're in your time of a challenge, that's exactly what you want. It's hard. People, it's that sometimes training sensitivity, because if you're going through something, you don't need to be aggravated by someone with an attitude or go to a place that, isn't inviting, and help you to feel calm and relaxed, because that's going to help that whole process.
Absolutely. It's so important. And, during, for a PET CT, you want to stay nice and calm. You don't want, any kind of your blood sugars to spike or anything like that. We try to optimize the examination by keeping everybody comfortable and, quiet during the examination. So we get better results, absolutely.
Wow, that's incredible. And so when people go to their doctors, what might be some of the issues that they might be having, the distinction between the PET CT and all the other stuff? There's lots of them.
Well, Emery, let's talk about what we do here at Western New York PET CT. Yes, we have PET CT and we have the Standalone CT. So either exam could be performed here, and certain examinations that will be performed here with the PET CT are usually oncology studies, recently diagnosed cancer. So we want to see how the extent of the cancer is so we can plan the therapy for each patient. So the extent of the disease will kind of tailor the amount of treatment that is necessary to treat the patient and hopefully get a successful outcome. For CT, we do the gamut of CT scanning here. It's a 64-slice CT, head CT, chest, abdomen, pelvis CTs. And, patients usually come in for, a prolonged pneumonia. You get a CT of the chest just to make sure there's no underlying mass or lesion. People constantly have belly pain. If they're worried about an appendicitis or diverticulitis, we can easily handle that. We do all kinds of vascular imaging here with CTAs. So that's very important to make sure that there's no obstruction or blockage, or if you have an aneurysm of your abdominal aorta. Those are kind of some of the routine things that we do here day in and day out, which we can handle quite easily here at Western New York PET CT.
Wow, routine things, and I'm thinking, geez, it is so important. And the more you talk, the more I'm getting how vitally important it is to have such an outstanding, extraordinary facility such as this. And I wondered why I hadn't heard of the PET CT. And when you said oncology, cancer, I thought, I hope I never have to hear that one. But unfortunately, we have a lot of that in this area.
Absolutely, but also it sometimes can help rule out cancers or help with the remission in where we follow up cancer patients after therapy, and they can get a clean bill of health with the imaging. Clinical and imaging go hand in hand. So if we can get, a patient that has gone through the therapy, be it surgery, radiation, and chemotherapy, and they come back and they have a clean bill of health by PET-CT, and clinically their doctor examines them and their clean bill of health, well, then we can start spacing out the visits to the doctor, the imaging, out from 3 months to 6 months to a year. So hopefully that's really the routine that we want to follow, so patients are successful in their treatment and therapies of beating cancer. Absolutely.
Wow, what a blessing. What a blessing. That's amazing. And you mentioned 64 slice. I remember the last time we did a show here at this facility, we were talking about the 64 slice because it was the hottest thing in the area, and the news was reporting that not everyone had a 64 slice. And I called Dr. Mascaro and he said, yes, we do have one, and we did a show here to bring you that information because that's a very advanced test.
Absolutely. What it does, basically, it scans the body faster. Now, we have a lot of patients that have breathing problems. They can't hold their breath that long. So now we can scan a certain area so much faster than 5 or 10 years ago. So instead of getting motion artifact that causes limitations in the examination, we get to scan the body real quick. They get to breathe normally. They don't get upset or anxious because they're not able to breathe, and we get a great exam. That's the importance of 64 slice CT, absolutely.
Wow. And I like what you said too, that's something to talk a little bit about too, the advancement of the equipment and how, just like technology, you buy a cell phone today or this brand new whatever, I'm not going to say any brand names, but you buy one thing and then 5 minutes later they're coming out with another one and your technology is outdated, and it happens with computers and cell phones and TVs, and I didn't even realize the importance that must be happening with this equipment on a daily basis.
Absolutely. Every day, every month, there's a new update, software, hardware. So we keep up to, pace with all of the upgrades that we can, and we want to provide cutting-edge technology to our patients here in the Western New York area. So that's very important to us. Sometimes we totally will scrap one of our hardware.
Wow.
To go to something newer that can do a better job. We've done that with our PETCT system. We weren't even done paying for our PETCTs, and it just couldn't bring us to the next level and provide the services for the patients and the physicians that wanted to use our services. So we went out and bought the best technology that we could, and now we can be anywhere in the world, anywhere in the country, anywhere in the state, anywhere in Western New York, and be able to touch and be in communication with our PETCT system, which is the archive where we hold all our images and our reports. So doctors can log into our PETCTs, get all the information on their patients, all their imagings, and the reports right at their fingertips. So that's why we feel that that was very important to do.
Wow, and it doesn't surprise me that you say that you weren't even finished paying for one system and you were purchasing another, because I've gotten to know Dr. Mascaro over the years, and you're not, you just know, at least I do, I could tell people, and some of you are the same way too, is that you're not just in it just for the money, just to keep building, and and it's that corporate, you could tell you care about people, you care about this area, and you evidence that by sponsoring this show, which is bringing this information and doing all that you do in the community. We really appreciate that.
Thank you. It's very important to us. We here at Western New York Imaging Group have the family kind of attitude. We have over 70 families that depend on us to make sure that we continue to go to the next level, continue to increase and do a better job towards our patients. So that's what's important to us, and that's why we try to bring imaging to all the corners of Western New York as far as we can, absolutely.
And I know that you are, because you've heard where his main facilities are. But like I said, there's a lot of other places that have Dr. Mascaro's imaging equipment in them. They're just not marked as, Kenton MRI or Lockport MRI. They're all over the place.
Right. We feel that areas that it helps out the community, we'll go into a certain area that really is beneficial to the patients and the physicians in that area that need the imaging, need the quality, and for their patient care. I mean, that's what's important here. I mean, if it wasn't necessary, we wouldn't do it. We feel that it's important to provide services to people in all areas of Western New York, and that's our goal. That really is our goal.
Wow, that's beautiful. So would you like to tell us about some of the other facilities too, or is there more that you want to tell us about this?
Well, one last thing on Western New York PET-CT, the emerging area of PET scanning is basically Neuro PET Scanning. So we always hear about Alzheimer's disease, Parkinson's. There's some great studies coming out now. They've been doing a lot of research, especially in Pittsburgh, Pennsylvania, University of Pittsburgh, but also here locally at Roswell Park. And there's going to be some great neuroimaging with PET-CT, and it's right here locally, and we're part of that project, and we're very excited. Once we have some more information, we'll be forthcoming with that, absolutely.
Oh, wow, I got to ask, there's a couple questions about that because I've been studying some things about Alzheimer's. Well, not really studying, but I watch a lot of the programs so that I could stay up to date on health issues. And what I was learning was that Alzheimer's just isn't one blanket Alzheimer's, that's it. That there's several different areas of the brain. I'm thinking of 64 slice now, which you said. Several different areas and different signs where somebody might be diagnosed with dementia or Alzheimer's, and it might be just one little specific area that's not remembering. Or can you tell us a little bit more about that?
What's really going on? They're trying to map out the brain and what areas are affected. But the most important thing, as it is with oncology or cancer, is early detection. And that's what they're working on, is trying to detect it at the earliest possible stage for you to have some therapy, be it a medication or, whatever therapy that is going to be accustomed for that. But I feel right now that's where we are, is trying to get to the point of early diagnosis. I mean, somebody would be fine and, maybe a really, little bit forgetful, and you see them decline very rapidly. Well, we want to catch them early on, getting them on the medication, and hopefully slowing that process down. Like you said, Alzheimer's is a continuum. It's not like one day you have it and the next day you don't, or vice versa. It's basically, it comes on slowly, and then all of a sudden you see the dramatic change in the patient. So we hopefully, with these new imaging agents that are coming down the road, that we can basically find out real early in how to intercede and slow that process down.
I'm really glad to hear that, because I know that is quite a difficult and challenging, situation to have to deal with, not only for your loved, well, even more so the people around the person who has it. It's got to be very, I know people who are suffering with it now, so that's really good to know that our medicine is making strides. Things that used to kill us years ago don't anymore. And what you said, I'm going to reiterate this one too, this is the most important thing. When you stay proactive, see, and here it is, you're getting the information again. Right. So when would somebody know, like forgetfulness, because I have a lot of forgetfulness. People say, you don't have Alzheimer's, Amber, you're just doing too many things. I got my hands in so many different things. I have to write lots of notes to keep up with my own self. So how would somebody know when it might be time to take an exam so that they can start medication?
Well, I think usually it's the family around the patient that is the first to kind of see changes. And the doctor. Patients that go regularly to their physician, all of a sudden they start seeing, well, what's going on here? You've really changed quite a bit since we last talked. And that's very important. So really it's important for all the patients that we talk to today is that go to see your primary care doctor, not just once a year, but whenever you need to, a minimal once a year for your physical, but I think that's very, very important. And, they're the people that are going to initiate all this. And sometimes, they'll see it. They'll see a patient's decline in their mental status and their forgetfulness and their daily activities.
That is such good medical advice, because I can't even stress it enough. Having the relationship I had with my doctor for so many years, he became ill, so I switched over. As a matter of fact, I kind of said it on the show too, so everyone knows I switched over to Dr. Bennett. I was talking about him all the time, and I know that you're doing some construction we're going to see Dr. Mascaro over there too pretty soon. And I switched over, had to, because my past doctor is very ill now too. But the importance and the comfort to know, because I've had lots of different things come up throughout my life with accidents and other stuff, and a lot of family hereditary things, that I can go in when I'm concerned about something, get information, and then be proactive. Because you know what's going to kill you, what's going to hurt you, is the ignoring it, and that's what you spoke about.
Absolutely. You have to be proactive. You have to visit the physician regularly. Tell them what's going on, changes that, in your everyday life. Those are things that doctors are in tune to listen to, and hopefully make sure that everything's all right. That's the important part.
Wow, that is just so amazing. So anything else about this facility? You want to touch a little bit about another one?
I think we covered Western New York PET CT pretty good. I think we've had multiple shows on Western New York Breast Health Center on Sheridan Drive. We have full women's imaging there, as well as X-ray and ultrasound. Kenton Open MRI, we have full services there. Open MRI, CT, radiographic equipment, X-rays, fluoroscopy for upper GI series and things like that, ultrasound. So we have a full complement of equipment at Kenton to take care of all your needs. In the North Towns, we have Lockport MRI, great imaging there, taking care of the North Towns, the first MRI in Eastern Niagara County there. So we have a good following, and, I think that's very important to have that kind of service in Eastern Niagara County. And as you said, we have multiple small offices, throughout Western New York, and we try to expand on those services for patients that, that can't reach the bigger sites for their everyday imaging, such as chest X-rays or ultrasounds.
And you've been such a blessing, because Dr. Mascaro has brought Health Matters into many of these other facilities that aren't necessarily his own, but he has some imaging equipment there. So that works out really good inside of that atmosphere as well.
Absolutely. It's important. We've tried to integrate with the internist and family care practitioners, and that's been an important part of our expansion into the community. I mean, that's the segue. They always say that the internists and the family medicine doctors are the gatekeepers, and that's absolutely true.
Well, I'm so glad to have been here again. Thank you so much for all the information. And I just can't say how exciting it is to be able to come into all these facilities, come behind the closed doors, get to see what someday you may have to come in and feel for your own self and go through for your own self. So once again, folks, you have the information. Thank goodness for people like Dr. Mascaro and Dr. Bennett and Dr. Barnes and so many of them, so many of our partners who help to bring you this information, because the information is power, and that power comes when you pick up that phone and call. Now, in Dr. Mascaro's case, remember, next time you're at your doctor's and he says you need some imaging or an X-ray or a sonogram, whatever, tell him you want to go to Western New York Imaging Associates. So until next time, keep those emails coming, keep your phone calls coming. I absolutely love hearing from you, because your health matters.